There is a lot to be pleased about in terms of smoking cessation. Over the years in England, smoking rates have come down significantly, especially in people aged 18 to 24, which is brilliant to hear. However, still in England, 11% of the population are smokers, and in London, the rates are slightly more like 12%. I'm a psychiatrist by background, and I'm particularly interested in health equity and equality, because many of the patients that we work with in my area are from the most marginalised parts of society. And we know that in deprived populations or in deprived areas, smoking rates are twice that of the general population. But in people living with severe mental illness, the rates are up to 4 times. So it remains a really significant health inequity in these parts of the population. We know that your chance of dying early from cancer, lung disease, and cardiovascular disease are all significantly higher if you are living with a mental illness. And these are all smoking-related problems. So it remains a significant problem for people working in mental health and people living with mental illnesses. Currently, I'm standing in north central London between Islington, Haringey and Camden. And in this part of London, men living with a severe mental illness lose on average 18 years of life, and women lose 14 years from life. And that is often due to causes which could be delayed or prevented. And it's worth pausing for a second and thinking about those numbers and those years of lost life, because it's a really significant equity problem from my perspective. In some of our boroughs, we have really high rates of lung disease and of smoking. So it's something that I'm particularly keen for us to work on locally and across the region. We also know that most people who smoke wish they'd never started. And we also know that people in deprived areas and from marginalised groups, including people with mental illness, are less likely to get access to support them to stop smoking. However, the evidence also tells us that people from deprived areas and marginalised groups can use and do use the support when it's available to them and can be helped to stop the same way as the rest of the population. I think this is why working together as a community of health and care providers, local authorities, voluntary sector organisations and of course the public is absolutely key to continuing the downward trend in smoking. I'm really pleased to be part of the celebration for 3 years of the London Tobacco Alliance, who have been spearheading the smoking cessation project across the region for all of that time. And I think their approach of bringing people together from this range of different sectors that I mentioned, as well as highlighting some of our more specific vulnerable groups, for example, expectant mothers and people with mental illness, and providing a forum to share good practice and resources to help people stop smoking. All of that's absolutely invaluable to the region, especially at important times like Stoptober, when we're currently filming. I was particularly pleased to have been able to be clinical lead for London's first Mental Health and Smoking Week, which was in June 2025 this year. We looked at a number of topics during that week. We talked about the link between mental illness and smoking and the high rates that people living with mental illness have of smoking. And we talked about how we can get better support to those people who really need it. We also talked about the link between stress and anxiety and smoking, and how, whilst a lot of people think smoking is a good way of dealing with stress, we established that it probably makes the problem worse rather than better. We also talked about vaping and how vaping for people who smoke is a safe and good option for reducing their smoking and potentially stopping. And we talked about the experience of people who've used stop smoking services. We had some brilliant contributions from clinicians and people working as tobacco dependence advisors and patients who had managed to stop smoking with the appropriate support. Putting all of that together, we had a fantastic, really positive campaign that brought people together across all parts of our region. Smoking rates are coming down, and that's brilliant. And there are some really good opportunities on the landscape at the moment. We have, at the time of speaking, the Tobacco and Vapes Bill, which is making its way through Parliament but hasn't quite become law yet. What that will do is create a smoke-free generation in future by making it harder and harder for young people to buy cigarettes and tobacco products. And I think that has the huge potential to benefit everybody, but particularly people from marginalised groups like the ones I work with day to day. We've also got more tools to help people stop smoking at our disposal than we have for a long time. We've got medication, including varenicline and cytosine, which we could be using more, especially in mental health settings, because we know that they're safe and effective. We've got tobacco dependence advisors, again, working in mental health settings. We've got a lot of findings and learning from something called the QUIC Collaborative, which was a quality improvement project that the Royal College of Psychiatrists undertook in the last couple of years, where we learnt a lot about how inpatient mental health settings can support people better to stop smoking. We've got the rollout of the NHS England lung cancer screening programme, which has huge potential to detect early signs of lung cancer at a time when it's treatable in populations who smoke or used to smoke. So I think all of those things together mean we're at a much better place in terms of how we can help people stop smoking and deal with the potential health consequences earlier. Of course, though, there are challenges as well. The tobacco and vape industry continues to find opportunities in the new legislative and health landscape. We need to think about how we ensure that people, for example, don't start vaping when they don't smoke, especially young people. In our smoke-free generation, we want to make sure that we don't have people vaping instead of smoking. Funding to all sorts of health services, including tobacco dependence services, is always vulnerable, and we need to be very mindful and very clear in our messages to policymakers and to local authorities and to people who commission healthcare that these services are vital to our populations because they very often feel under threat. This is why it's key for organisations like London Tobacco Alliance to continue to be at the forefront of leading our region on this issue. I'm really pleased that they're celebrating 3 years. I hope that they have many more years of working together with people like me and people across the region, and many congratulations to them on this milestone.